There are questions tonight about how Canada's vaccines are being rolled out. Some provinces are reserving half the doses they receive so the first recipients get their second shot in time. But new data suggests Canada could be better off if all doses were rolled out to as many people as possible. Abigail Bimman explains.
South Africa has seen 14,000 new coronavirus cases in the past 24 hours and 400 deaths. The health department believes a new variant is behind the surge, different from the UK's new strain.
No longer any sickness that we know it's COVID all the time.
Nigeria is now reporting a new strain of its own. In Canada, vaccines are coming. Health Canada approved its second this week. Both require 2 doses. So what's the best way to roll them out? 2 new studies were presented to Ontario's Science Advisory Table this week.
Both presentations came to the conclusion that front-loading the doses and not reserving some of the installments as second doses would be the more efficient strategy.
One study showed withholding fewer doses could prevent between 25 and 40% of symptomatic COVID-19 infections, compared to reserving half the doses. BC is among the provinces which has said it won't reserve.
I have a real challenge leaving vaccine in a fridge when there are so many people at risk right now.
But Ontario and others have said they will reserve the second doses over supply chain concerns. Ontario's Ministry of Health tells Global News while some people may have good immunity after only 1 dose, it's not guaranteed and a second dose is necessary.
We have enough doses in hand at this point that we could partially protect most of the people in long-term care in Ontario.
Dr. David Fisman says vaccines should not sit on shelves, but he wants to be clear a second dose is still needed.
When you look at the trial data, what you see is there's a lot of protection in people already after just the 1 dose, and that may wear off, in a few weeks' time, and that's why we want them to get the second dose. But at a time when a lot of folks are getting sick and dying from this disease, the idea is to get it into as many different people as we can.
The National Advisory Committee on Immunization also tackled the question of reserving doses in new recommendations released Wednesday. It looked at all kinds of related ethical questions and determined each province should make its own decision based on its own analysis and context, including considering any unintended consequences that could happen if a second dose is delayed. Robin?
Abigail Bimman in Ottawa. Thanks, Abigail.